Pain management after an operation and during an operation actually is critical, not only to the patient's comfort, but to their ultimate recovery. And proper management of that includes actually stopping the pain before it starts. And that starts before surgery then. And what we do with many operations, in fact with all the operations that I do, is before we ever start surgery on the patient, we anesthetize the site where we're operating. That prevents the patient's neurologic system from getting all fired up, in a sense. Whenever we have an injury, our nerves react instantly. And what happens is it sends a message to your brain saying, there's a problem here. And the brain reacts, and if that feedback system is happening for the minutes or hours that an operation is happening, by the time the patient wakes up, if the pain has not been blocked before it started, that whole cycle is going on, and the patient wakes up from surgery and like, wow, something's really wrong down here. And then it's hard to get that pain under control. So the proper way to manage pain in a situation around surgery is to block it before it starts. And that involves sometimes doing a nerve block and placing a kind of a catheter in there to allow pain medicine to continue to keep that nerve blocked, that is numb, after surgery. And sometimes it involves simply putting that numbing medicine right at the site of surgery. It depends on the specific operation and exactly what you need to do. But those two strategies, sometimes employed together, are exactly what a person needs to do to stop that pain from getting bad. Then when the anesthetic is over, the general anesthetic, or sometimes just the nerve block anesthetic, when that wears off, then the pain hasn't really ever started. And during the recovery, it's a much, much smoother process. So it's all about what people call preemptive analgesia. You're stopping that pain before it starts, and then it simply never gets that bad.